My name is Dr. Punit Thawani. I am originally from India, but I grew up in Dubai. I am an orthodontist. I specialize in straightening teeth and in improving the smile. Typically what we use and what most people associate orthodontists with is braces. So you could say I'm a specialist in braces. However, orthodontics involves a lot more than just using braces. The whole idea of orthodontics as a specialty is to improve the aesthetics, function and stability of the teeth. And what I mean by this is not only do we straighten the teeth and make the smile look good, we also get the teeth into a position where they can function well with each other in terms of the biting, speech, in terms of harmony with the muscles, with the joints of the jaw, and also kind of look at how the whole system works over time. So if we are treating a child or a teenager, there is growth that is going to be taking place. So how would the teeth look? How would the smile look as the child grows? Or if you're looking at an adult, then over time as they age, how would the teeth look and how would they support the face and the soft tissues of the face during the aging process as well. A good orthodontist is someone who looks at, gives a lot of importance to diagnosis and treatment planning. Okay. Every patient who comes in has a unique set of problems, not only medically or dentally, but also a socio-economic point of view. So apart from their medical and dental problems, we also see what is the person's background, because there is a person who has those teeth in him. It's not just the teeth that we are treating. Okay. And try to tailor a solution that fits that person's medical, dental needs as well as their social and professional needs. So the braces and aligners are two different modalities of straightening teeth and getting teeth to a correct line and to a correct bite. Okay. Now the difference between braces and aligners is that braces typically are fixed on the teeth, so they cannot be removed by a person. They can be only removed by the orthodontist or the treating doctor. Okay. Whereas aligners are a removable solution. The other aspect of aligners is that there is a lot of technology involved in creating aligners or in developing aligners. So typically we need to have a three-dimensional, a virtual 3D model made of the teeth and of the treatment that needs to be carried out, and then the aligners are made to that specification. Okay. Whereas braces, although it is possible to have a three-dimensional or a virtual treatment plan for braces as well, typically they are not done that way. Typically they are placed directly onto the teeth, and the movements are controlled by the operator or by the doctor. The end result of both of them is straight teeth. Okay. Despite the fact that the modalities are different, the end result is that the teeth get straightened and the bite is improved. In certain cases, you need more control over the kind of movements that are required to move the teeth to the correct position. And in those cases, most orthodontists and I personally prefer to have something fixed. It tends to give you a little bit more control over how the teeth are moving. Aligners are a great solution for treatments which require certain types of movements, which they do very well. Okay. But beyond that, aligners do have some limitations, in which case we need to go back to braces. So it's typically up to the operator or to the doctor to decide for a particular patient what would be the most appropriate depending on the kind of treatment, the kind of movements that the teeth need to be corrected, and what would get the teeth to come into a good position, to look good in the smile, to look good in the face, and to look good over time. The most important difference between the brands is unfortunately something that a patient cannot see. It's something that a doctor has to see and decide. It's pretty much the back end, the software that is used to develop the treatment plan and to control the movements of the aligners. So that's one aspect of it. The other aspect of it is the actual material that the aligners are made from. Okay. So these two, although outwardly they might look the same, but because of these two aspects, different aligners are different. They don't always give you the same result. There are some which I have seen are more effective than the others. Typically, between a year to 2 years is how long it would take to get full orthodontic treatment done. Everyone does not need full-fledged orthodontic treatment. For some people, just a simple alignment is enough, which can be done in 6 or 8 months. Depending on what treatment you require, like you could say treatment varies from 6-8 months to about 1.5 to 2 years. Coming to retainers, the function of a retainer is basically to hold the teeth in the corrected position after the braces or after the aligner phase is completed. Now, after moving the teeth, they always have a tendency of moving back to the original position, and this tendency is the highest over the first 1 year. Okay, so typically retainers have to be worn very religiously for the first 1 year. I have seen a lot of people feel aligners can be worn whenever they want, or aligners can be worn just for a couple of hours a day and they will magically straighten the teeth. It doesn't work that way. To be effective, they have to be worn full time. You remove them when you're eating and brushing, so there's an advantage that there are no restrictions in what you can eat. You can clean your teeth well, but you still have to wear them all the time. Tooth movement at the end of the day is a biologic process, and there are certain aspects of biology that you have to respect regardless of the appliance you're using. Another misconception when it comes to aligners is people feel that you don't need a retainer after using an aligner because you've not had braces, so you don't need a retainer. But that's not true. Once again, tooth movement is a biologic process. Relapse, that is teeth moving back to the old position, is also a biologic process. So whether you move teeth with braces or aligners, you do need to wear a retainer for a certain amount of time to maintain the teeth in the correct position. Another misconception with braces is that there is a specific age when braces can be used, or there is a specific age when your teeth can be straightened. That's not necessarily true either. As long as you have a healthy gum and bone condition, there's no age limit. Teeth can be straightened at any age. We start normally at the age of 7 or 8, and there's no upper limit. We can go up to almost any age to straighten teeth. Of course, the objectives of treatment would change, but it can be done at any age. For example, now Invisalign has a product which they call Invisalign Teen, okay, which is specifically designed for teenagers. They take into account that the teeth are still erupting and the bone is still developing, and it is made to that specification. Okay, so aligners are increasingly being used in teenagers. Yes, there are certain limitations to what can be done with aligners, as I mentioned, but once the doctor figures out what the limitations are and whether it would work in a particular patient or not, we can advise accordingly. But aligners are increasingly being used in teenagers. I have 15-16-year-old patients who are asking for aligners and who are being treated by aligners, and the results are very good as well. There are some people who do not want aggressive treatment. There are some people who want to look perfect. So depending on what your situation is, I could propose different plans for you. We are located on Sheikh Zayed Road, very close to Shangri-La Hotel, and easy access. We even provide parking for our patients. And if you are looking for one clinic to take care of all your family's dental needs, and we'll be happy to help you.